For next off, we're talking about another nerve issue, okay, which is of importance to orthopedics. So this is the Anterior Interosseous Nerve Syndrome. Anterior Interosseous Nerve Syndrome. So of course, if they are discussing something like this related to a nerve, you know that they are talking about possible issues that could happen to that nerve. You understand? So this is the anterior interosseous nerve. They usually abbreviate it as what? AIN. Anterior interosseous nerve, AIN. So for this nerve, we're saying there's an issue with this nerve. Okay? So the syndrome is more of like, it is now affecting every region of the body that is supplied by this nerve. Do you understand? So it's just like you want to tackle a problem, you are tackling it from the root. You okay? So anterior interosseous nerve syndrome is also known as what? The Kiloh-Nevin Syndrome. It's a rare neurological condition, usually affects the forearm. Okay? Because you have the anterior interosseous nerve right here at the forearm. So what is it? The anterior interosseous nerve syndrome is a pure motor neuropathy. So it involves the anterior interosseous nerve, which is a branch of the median nerve. Okay, so unlike other nerve syndrome, it does not affect sensation, only motor function. Okay, let's move. So anatomy and function. Just so you know that the anterior interosseous nerve branches off from the main nerve, which is what the median nerve. You see it there. Okay, so it travels down the forearm. Okay, so what are the muscles that this nerve supplies? The flexor pollicis longus, okay, FPL, okay, the flexor digitorum profundus, that's what, the FDP, okay, then the Pronator quadratus, okay, Pronator quadratus. So these are the three muscles that will be affected if there's a syndrome of this nerve. Okay, so if there's an issue with this nerve, it could lead to what? Weakness in pinch grip. If you want to say okay like this, look at this. If you want to say okay, you can't be able to say okay, it is abnormal like this. Do you understand? So one of the ways of dictating this is, for a patient that has this issue, you tell them to do this sign. Do you understand? So if it is like this, you know that it's abnormal. Okay. So there's difficulties with doing some tasks like buttoning or shape, because buttoning or shape is more of like we are using like this to button up. Okay, there's dull localized pain in the forearm or elbow. No sensory loss. Okay, no numbness or tingliness. It's just or tingling. It's just the motor activities that have issues. So causes, it can be spontaneous where the nerve is inflamed. Okay, it could be brachial plexus issues. You know. So traumatic, it could be from forearm injuries, could be stab wounds, you know, surgical complications, you know. Compression sites, most commonly at the deep head of the pronator teres muscle. Okay, so diagnosis: pinch grip test. You should do like this. Okay, then imaging, then electromyography. You are just trying to look at the electrical activities in the nerve and the muscle. Okay, so treatment: conservative, anti-inflammatory medications if you are dealing with neuritis, you know, physical therapies and rest. So surgical approach, you know, if the thing has gone beyond 12 months. Okay, so that's just what the anterior interosseous nerve syndrome just simply means.